From CareCredit, it's Care Experts, a podcast where we dive deep into the health and pet care industry with the professionals that make it happen. I'm Antonio Diaz, and this is Logan. Today, we're tackling an important topic for all the cat parents out there. If you have a cat, especially a male cat, there's one word you need to know: blocked. Feline urinary blockages are not only painful for cats, but they can also be quite serious, and they happen way more often than many cat owners realize. In this episode, we're joined by Dr. Tannetje Crocker, an emergency veterinarian and practice owner in Fort Worth, Texas, to talk about what a urinary blockage actually is, how it's different from a UTI, and what every cat parent should know to prevent an emergency. She's seen far too many cats come into her ER vet with blockages, and she's here to walk us through the symptoms, the treatments, and prevention tips to keep our feline friends safe and comfortable. Dr. Crocker, I'm excited to have you here. You know, most people would assume that because I'm a dog guy that I don't like cats, and that's not true. I actually love cats, but I don't know too much about them. So I'm really excited to hear about blockages and UTIs, the difference between the two, and how we can help cats live better and healthier lives.
Well, thanks for having me. I'm very, very excited to get into it.
So the first thing I want to address is what the difference is between a blocked cat and a cat with a UTI.
Well, I appreciate you being open to cat education because these are really serious, important topics for us to talk about. As an emergency veterinarian, I see blocked cats all the time. And I actually see a lot of cats with UTIs that people bring in because they think they're blocked.
Okay.
So the big difference is, and I wish I had like a whiteboard, but one is the cat has an inflamed bladder and an infection. So that would be a urinary tract infection or UTI. And they're actually peeing really frequently. So they're still spending a lot of time in the litter box. They're uncomfortable, but it's because they have that urge and that need to pee a lot.
Okay.
When they're blocked, they actually get something in their urethra and they're blocked and they can't pee.
Okay.
So their bladder's really big, it's really hard, and that is not associated with an infection in a majority of the time. So that's kind of the big difference. UTI, infection, small bladder, peeing frequently; blocked, no infection, big bladder, unable to pee, but they both spend a lot of time in the litter box and are uncomfortable.
Okay. Based on that description, it sounds like a blocked cat is way more of an emergency than a cat with a UTI.
Yes, it is very serious. So if they block and they're unable to pee, what that does is it puts pressure on the kidneys. It actually sends them into acute kidney failure or renal failure, and it causes their potassium levels to go up really high because your potassium is excreted in the urine.
Okay.
What that causes is a possible fatal arrhythmia of your heart, and they can actually die from it.
Wow.
So if your cat is not producing any urine at all, if they're spending a lot of time in the litter box, they're uncomfortable, it is absolutely important to get to a veterinarian as soon as possible.
Okay. Now, with that said, my first thought is cats go in the litter box. Most people have litter boxes in a bathroom, in a closet, so they're not really aware of when their cat's going to the bathroom.
Right.
Most people know when their dog goes pee, but their cat is doing it on their own time and terms. So what would you recommend for somebody? Is it to just have a better idea of when their cat's using the bathroom, so this way they know whether or not it's happening?
Yes. So a couple things. One, this is much more common in male cats.
Okay.
Female cats don't really get blocked unless they produce really big bladder stones.
Okay.
So more common in your male cats. It's definitely important to monitor their litter box daily. So cleaning it daily to make sure they're producing urine would be one thing. A lot of these cats are so uncomfortable, they're actually trying to pee all the time. So they're spending time in the litter box, straining in a pee position, they're vocalizing, they're crying out, and sometimes they go off their food completely, and sometimes if it's bad enough, they actually start throwing up. The number one thing that people will think is their cat is constipated because they're in their litter box, they're in like a crouched position, they're trying to go, and they'll bring them in because they say they're constipated, but we'll feel their belly, we feel a big bladder, and they're actually blocked instead.
I see. Now, it's considered an emergency, but at what point? How soon after a cat becomes blocked does a person have, when does that clock start ticking?
So I would tell everybody immediately.
Okay.
The sooner that you get them treated and looked at, the better chance of fixing it, number one, and preventing long-term kidney damage. So if you are noticing their cat is in and out of the litter box a lot and they're producing either just little dots of urine or no urine, I would absolutely get them checked right away.
Okay.
It is easier you have to sedate them and pass a urinary catheter to unblock them. It's easier to do that if it hasn't been going on as long usually.
Okay.
And again, the side effects that, occur with the kidneys and with the potassium levels, you don't see them as early on. So it's safer to sedate them and unblock them if you haven't had those things happen.
Okay. And what exactly causes a blockage?
So basically what happens is because of inflammation in the body or stress, they get cortisol spikes. And because of that, their bladders get angry. And that can cause the pH to change. That can cause a lot of things to happen. So usually the blockage is either blood, because it's caused inflammation and bleeding in the bladder, or it's crystals that have occurred because of diet and stress. And so a lot of times when you release it, you'll get little crystals out, or you'll get a big plug of blood and cells out. It's not usually infection associated, which is an important differentiation between being blocked and UTIs, but it's also not something as easy to treat. Because if it's an infection, you give antibiotics, right? If it's related to stress and other things, who knows what stresses a cat out?
Yeah.
So we see it most commonly when people move, go out of town, things are happening in the household, new cats in the household. So it's really important to monitor your male cats during all those types of changes throughout the year.
Okay. Couple questions. One is I like that you mentioned diet. Because I think it'll help clarify maybe what type of diet can cause that to happen versus what diet would be best to prevent it.
So I kind of tell people it's similar to people that make kidney stones, right? There's probably a genetic component to it a little bit, and then the pH of the urine is based on the diet. So sometimes we'll see it if people change their cat's diet all of a sudden. We'll see it if they are doing more dry food and less canned food, because we do know that getting more liquid in them can help with flushing the bladder and keeping it, things moving through. So there's not one diet that I can say this is bad. There's not one that I can say is good. There's definitely ones that have been tested that have been shown to make the pH better, to not produce crystals, and also cause them to drink and pee more, which just self-diureses the kidneys and the bladder. But it's just really important to get the urine checked, see if there's crystals, see if there's blood, and then probably trying a diet and then rechecking the urine is the most important thing.
Okay.
And there's not one diet that I would say, you do this one and your cat will never have an issue again, or do this one and your cat's definitely going to have an issue.
Okay.
I do think combination food of dry and wet is great if you can't feed just wet food, but the more water you can get in your cats, usually the better in the long run, especially your male cats.
Okay. So would a urinary sample be a good idea to provide someone like you frequently, like 3 months, every 6 months, to kind of test and make sure that their food or whatever's going on in their life is tracking to keep them healthy?
So usually with your routine vet visits, your annual visits with cats, especially after a certain age or if they're male cats, you're going to recommend doing lab work and checking urine, because we know if we can prevent these things from occurring in the first place or keep the kidneys healthier, it's going to help us in the long run. So that'll give us a lot of information around how well the diet they're on now is affecting them overall. If they have an issue, what I usually do would check the urine. I would change the diet or do whatever environmental changes I need to do, and then recheck about 30 to 45 days later. And then every 6 months or so, depending on how the cat's doing. Now, my cat obviously gets frequent checks because his mom is a veterinarian. But I would say most of the time, if they're doing well and they're on a diet that's working for them, yearly checks is probably good at that point. He's been on a special diet for 8 years, and we have, knock on wood, not had any additional emergency visits or issues.
Okay. Now, you talk about male cats. Is this something that we never see in female cats, or it's just not as common?
That's a great question. So female cats don't get blocked because their urethras are bigger, so they can pass usually crystals and blood easier. They can absolutely get angry bladders and still get issues, and they are more likely to get UTIs because there's not as much distance between the outside and their bladder. So they get ascending infections easier. But diet can matter to them. So again, checking urine and seeing if there's bacteria, seeing if there's crystals would be warranted in female cats too.
Okay. Can a UTI lead into a blockage?
So I think it's a very small percentage of male cats that will have UTIs and be blocked. So I don't think so. I think it's more likely that the blockage would cause a UTI potentially. Like all the inflammation would allow for bacteria to set up. But it is definitely worth checking the urine to see if there's bacteria in there too, because they need antibiotics if there's a UTI.
Okay. And then as far as like the behavioral signs that somebody might notice for a UTI, what would they be?
It's really hard because they're the same as a blocked cat. So
Okay.
sometimes cats will frequently be licking themselves because they're dripping urine or it's uncomfortable. And then the other things are frequent litter box trips. A lot of times cats will actually pee in inappropriate places. So they'll pee in the sink or in the bathtub or on your bed
Okay.
and leave you a nice little bloody sample, letting you know that their bladders are pissed off and they're urinating more frequently.
Okay. I feel like this is a good note for the listeners. If your cat starts peeing in places that are unacceptable or maybe make you angry,
Right.
consider the fact that maybe it's a health issue and not your cat just being a jerk trying to pee on your bed.
I have a lot of people come in and they've never checked their cat, and their cat ends up having kidney disease, diabetes, a UTI, like something that we can treat for or we can try to manage. And so I think that is a wonderful thing to make sure that people are aware of.
Well, I know I deal with that a lot in my line of work because if I always tell people, if you have a dog who's, let's say, fairly well behaved and all of a sudden they start acting out in ways, my first thought is going to always be check and make sure that their health is in line, because a lot of times what we would consider a behavior problem is potentially a health issue if it's happening out of nowhere and very acutely.
Yes. And
So-
even in cats, this is an aside, but things like hyperthyroidism in cats will cause them to vocalize more, act erratically sometimes, have more night waking.
Okay.
And so people will start to get frustrated with their cat.
Yeah.
But really, they have a condition. And people that have thyroid issues will tell you they absolutely feel different. And so
Okay.
I think always checking with your veterinarian first and checking just those baseline preventative things is worthwhile.
Okay. Now, how would you help somebody differentiate between their cat marking and a cat that is struggling with a UTI or a potential blockage?
So male cats that are intact are going to spray and they're
Okay.
going to mark, but they're actually going to like go up against a wall and like spray the wall.
So
It's
they're
not
bee
them.
urine.
Yes. Yeah.
Okay.
But it's like it's not crouching like they're peeing, right? It
I
is,
see.
I'm going to mark this area.
Okay.
If they're not a male cat, they're not intact and they're just, going around the house and crying or vocalizing or not eating and they're peeing in very small amounts, I would absolutely get them checked out because I'd be more worried about a medical condition than a behavioral issue.
Okay. Now, in comparison between cats and dogs, are UTIs more common in cats?
I would say no.
Okay.
More common in dogs. And this
Really?
is not me knowing the
bias.
medical research, but
Okay.
based on what I see, especially in the emergency room and, the amount of dogs that have UTIs versus cats, I would say a majority of the time I'm going to see more in dogs than I am in cats. Cats are usually their urinary issues are more kidney related or diet related.
Okay. And as far as treatment goes, UTIs, from what I gathered so far, are going to require antibiotics, and a blockage is going to require sedation and a catheter.
A urinary catheter, and usually they're going to have to stay in the hospital for a little bit.
Okay.
So because their kidneys are damaged, you actually have to give them IV fluids to flush the kidneys and
Okay.
try to get the kidneys back on track, get the potassium levels down. So most of those cats are actually hospitalized for about 2 days with us
Okay.
to make sure that the bladder empties completely. We get all the crystals out or the blood or whatever, and get them on appropriate medications for comfort. Usually if you unblock them, you pull that catheter and send them home, the bladder's still angry. So it's just going to happen again.
Oh,
so they
okay.
need a little time to have everything flushed and worked through.
All right. So is that like a safety protocol too? So let's just say that I'm super on top of my cat. I know exactly when they go to the bathroom, or at least have an idea, and I know for sure they're blocked. I bring them in same day. Are you still going to keep them for a couple of days?
Absolutely.
Okay,
Yeah.
just
Because
for safety.
Even if you've just noticed it, your cat's been hiding it for a while. And the amount of either blood or crystals or cells in there that need to again be drained out by a continuous catheter is really important. And because the urethra is angry because it was blocked, it's going to be a little tighter. So if you don't have that catheter in there, even if we treated and we got out as much urine as we could, we're not going to get everything right away.
Okay.
So they need some time.
Okay.
They might spend less time with me, but they need some time.
Okay. So let's talk about prevention.
Mm-hmm.
So we know that a good diet, less stress can be some factors that play a
Yes.
role into prevention. So what lifestyle factors would play a role besides that? What are some common issues, I would say, stress-wise,
Mm-hmm.
that would cause a cat to become blocked?
So biggest things are we see this during certain times in life stages. So moving, adding new cats or dogs to the household, adding a baby to the household is
Okay.
another big one. Holidays when people are visiting. A lot of cats are not as social as people want them to be, so it
Yeah.
stresses them out. And then changes to, their diet, anything like that can definitely set a cat off. We've had some cats that the owners are like, my cat sleeps all the time. Like what stresses them out,
Mm.
And so maybe we don't always identify exactly what it was that caused the change. change. And that's where you start to wonder, is there any genetic things, or is there something with the diet specifically, or, is there a new treat they added, because that adds to the diet, right? And so there's a lot of, with these diseases, it's multifactorial, which makes it harder to manage, because if it's one thing that I could say, change this and it's going to fix your cat, I would do it. Gotcha. But usually once cats have had this happen and blocked, they're more prone to have it happen in the future, which is why we really promote doing your routine checkups, making sure that the diet they're on is working for them. And then there's some things you can do around the house, like I'm sure with dogs that are anxious, where you can do feel away, which is like the pheromone that can help with environmental calming. They say to have more than one litter box per cat in the house, so they have multiple options for litter. Increasing water, so like maybe a water fountain, things like that, to increase their water intake. All those things could be helpful.
Okay. And have you ever let me put it this way, is it possible for a male cat to go through their entire life and never be blocked?
Yes, absolutely. I think because I work in the ER and I see all the blocked cats and all the cases, and my own cat has the issue, I'm way more sensitive to it. So you might have had cats, someone might be sitting there saying, I've had cats for, my whole life, I've never had an issue. That's great. You're blessed. Amazing. Love it. But for anyone else that has cats and just wants to be aware of this, I want to make sure they know the signs and they know that this is one of the true emergencies. I tell people all the time, there's a lot of things they come in to see me. They could probably wait and see their vet the next day. This is an absolute true emergency. If it's the middle of the night, take them into an emergency vet, because the longer you wait, it could potentially be fatal. Yeah.
And I know what you mean. Like when you're in a certain industry, you start to see things more frequently. So you kind of have maybe, I would say a more jaded outlook on things. I know I'm that way when it comes to like dogs and children. Because I always tell people, like, err on the side of caution. I know you probably had a dog growing up and your kid was all over them, but it's probably a better idea to stay on the safe side of things.
Yes.
So
and so many people can't recognize the signs of a dog that's stressed. Similar to this, people don't recognize the signs of their cat starting to have this issue, and cats hide things really well. So by the time they're showing you, I'm really sick, this is a big problem, it's a big problem. So you need to kind of meet that level of concern.
Gotcha. All right, let's jump into our Ask Me Anything section. We have some questions that have been sent in by our listeners. So let's jump in. So first one is, we have 3 cats and one just had a UTI. Should we be worried about the other 2 getting a UTI since they share litter boxes?
Usually it's going to be an ascending infection just in the one cat, and it wouldn't be transmitted in the urine to other cats, especially with the way that litter clumps up and catches the urine.
What if the other cats were eating those clumps?
It doesn't matter.
Okay.
That's in the intestinal tract. It wouldn't be in the urinary system. You'd be fine.
Okay. All right, next one.
But one note.
Go for it.
I would get your cat checked, because you can get a little bit of bacteria in your bladder, but you should pee it out if your bladder and your kidneys are working well. So if you have one cat that's having an issue, I would just make sure their kidneys are functioning well. There's nothing else that maybe contributed that one cat to having a problem.
Okay. Yeah, fair enough. All right. I've heard that dry food can cause blockages and that I should switch my cat to wet food to prevent them. Is this true? My cat, Lady, has been on the same dry food for years and loves it. So I'm wondering if I really need to make the change.
Again, really good question. I would say I wouldn't change their diet without consulting with your vet. And if they've had routine checks, if they're not having issues, if their weight is well controlled, if their kidney values are good, their urine looks good, there's really no reason to change it. I do like having, in male cats especially, a lot of water that they're intaking, which means adding canned food sometimes. But some cats are really happy on a dry food and they're doing well. So I wouldn't change it, because you can cause issues just randomly changing their diet.
So if it ain't broke, don't fix it.
Oh, I love that. Yes.
All right. Can stress really cause UTIs in cats the same way it does in people?
I would say less likely to cause UTIs. It can cause cystitis. So it can cause inflammation of the bladder, like it does in people, because the cortisol spikes and inflammation, which can predispose especially female cats to UTIs.
On that note, would you have any recommendations? Like if somebody does move or something that would typically cause stress, is there any way that to maybe help soothe the cat and make them be less stressed?
Yeah, so it depends on your cat a little bit. So some cats, especially because they like to kind of hunt and eat, I recommend doing things that stimulate that. And so, there's like the little mice that you can put their food in, you hide them all over the house. And so things like that can help them get out, like their play behavior, promote positive serotonin releases, just any positive environmental enrichment with pheromones, with things that they enjoy to play with, I think would be really beneficial if
I
you're
love that.
moving.
Yeah, I think, I mean, same thing with dogs, honestly, like mental stimulation, essentially, like giving them an outlet for some of their natural drives
Yeah.
to help them live a more fulfilled life.
Yeah.
Perfect. All right. Will my cat Phoenix let me know if he has a UTI? Will it be obvious that they're uncomfortable?
If you're paying attention, yes. And I think you can catch early signs if you are cleaning your litter box daily, if you're watching their eating, their drinking, all of that. I think you'll catch it early on. And honestly, worst comes to worst, if you're suspicious of something and you have a male cat, take them in and get them checked. They might say everything's fine, everything's good. I love it when people come in and they think their cat's blocked, and I check them and I'm like, nope, they're good. And we figure out there's something else going on, but it's something entirely treatable, and a little less stressful. So
In your experience, what would that be?
there's a lot of things. I mean, I've had cats that ended up, they ate a Nerf bullet and instead had, ingested that, and they were actually uncomfortable and crying because of that. So entirely different issues.
Yeah.
But anything causing a male cat discomfort or not to eat would be worth getting them checked out.
Yeah. I'm sure it's good for you to see people coming in that are paying attention to their animals.
Absolutely.
Yeah.
And if an owner's concerned, I'm concerned. So I'm never going to say, as an emergency vet, like, why'd you come in? We're going to make sure that we work them up. And if it's something that can wait till you see your vet, great. If it's something that's a true emergency, like a blocked cat, then we're there to help.
Yeah. I love it. Thank you so much for all your insight and expertise. It's really been.
Are you excited about it? Like, going to talk about a cat a little bit?
No, I love it. Actually, I was a little nervous. I felt like I was in deep water early on, but I actually feel pretty good about everything.
I get it.
So,
I get it.
No,
now you're an
nailed it.
expert, so you're good.
Thanks. I'm going to add that to my list of things. I'm training cats next. So thank you so much.
All right. Thanks for having me.
Whoa. Don't leave yet. I just want to say, if you want to hear more about health and pet care, check out these episodes of Care Experts. Also, before you go, make sure you hit that like and subscribe button. New episodes drop every Wednesday. You don't want to miss it.